Hello, hi, I'm Dr. Bharati, gynecologist and infertility specialist, consultant in Bharati Fertility Center. Today, my topic of discussion is recurrent miscarriage. As the name suggests recurrence, it is quite, when it is happening repeatedly, it is called as recurrent miscarriage. So, usually after a married couple of say like 1 year time, there is a chances that 10% of the people will have abortion. In that case, you need not panic. You need not think that this abortion is going to get repeated again and again. This first time miscarriage is usually ignored. And it does not mean that once you have it and again you will repeat it. 10% of the couple will have a first time missed abortion, which is common. Suppose it's happening 2 or more times, then you come under the category of recurrent miscarriage. Then you have to worry. This happens in around 15 to 20% of the cases. In that case, you definitely need to meet a doctor. You should not think that it is because of the food I ate, or it is because I traveled, or it is because I had sex, or it is because I carried a heavy weight. It is nothing to do with what you have done. If the baby is good, it will continue. If there is a problem, it will abort. But it does not, you don't have to do the blame game and blame yourself and think that this was the reason. And not going to the doctor will not help. So once when it has happened the second time, it's always better that you go and consult a doctor and find out what could be the reason for the miscarriage. 70% of the time, unfortunately, we are not able to find out what is the cause for the recurrent miscarriage. But 30% of the time, yes, we can find out. So we should not miss this opportunity of this 30%. So how does this 30% contribute to? Like, first and foremost, it could be because of a uncontrolled thyroid or an uncontrolled sugars or an uncontrolled BP. These could play a big role because when it is not under control, there are so many birth defects associated with the baby. And usually these first 3 months, the cause is more because of these hormonal imbalance or because of the diabetic or an uncontrolled blood pressure. The second common cause will be whether the baby is genetically abnormal or whether the parents are silent carriers of some genetic abnormality. If the baby has a genetic problem, then it doesn't have that 46 chromosomes, then it can also abort in the first 3 months. So the abortion and then there are other reasons like thrombophilia cause, that is the blood supply to the baby is being clotted. It can be a protein C deficiency, protein S or an APLA deficiency. So we can screen the mother for these problems to find out whether this was the cause for the miscarriage. And usually in the second trimester abortion, that is like say from 12 to 24 weeks, it could also be because of an uterine anomaly. That is, either uterine anomaly means that the uterus is not normal. Either it can be a 2 uterus, or the uterus can have a septum, or the uterus can be small, or the cervix could be incompetent. There are so many factors like this. So this is usually a common factor in the second trimester abortion. So first of all, we should know what is the cause instead of blaming ourselves that this could be the reason or assuming that this could be the reason for abortion. So if we can find out these causes and rule it out, then we can have a safer pregnancy. And another important thing is that if suppose we are having an abortion for the second time, in that case, the fetal tissue can be sent for karyotyping. That is to see whether it has 46 chromosomes. That is 23 chromosomes from the mother and 23 chromosomes from the father together make a 46 chromosome. Sometimes there can be an additional chromosome or a decrease in chromosome. There can be a chromosomal abnormality. In that case, the baby is genetically having a problem. In that case, what we have to retrospectively go and do is to find out whether the parents are having any genetic problem or whether they are whether they are carriers. In that case, you should do a karyotyping for both the mother and the father. Okay. Suppose if the abortion is happening in the second trimester, then you have to do a fetal autopsy. That is, the baby is sent for an autopsy, whether the baby is seen externally and internally, whether all the parts are fine, or whether the baby has any abnormality which can lead to some genetic problem can be ruled out. Never say no when a doctor advises you to go for a karyotyping test of the fetus, that is a tissue, in the first trimester and the baby in the second trimester, because this can give us a lot of ideas about what exactly is the problem. So after knowing the cause, or if you do not know what is the cause, even in spite of doing all that, it doesn't mean that you will always have an abnormal child. Either one of the pregnancies will click that you will have a normal child also. So before going in for the next pregnancy, always make sure you take folic acid to avoid neural tube defects. That is any problem with the spine, brain, everything. Make sure that your sugars, your thyroid, your BP is all under control so that this can have effects on the baby. If there is a high increased BP, then the blood flow to the baby is affected. So the growth of the baby is not adequate. So there could be a fetal demise. So you should be very careful that all these conditions are taken care of and have a good sleep, good diet, mentally keep yourself strong. Instead of worrying why it has happened, make your mind strong to to overcome this problem. That is more positive thinking. All this together will help you have a successful baby. So don't worry that if you've had miscarriages 2 or 3 times. I've had patients who've had miscarriages of 5, 6 times and then also managed to have a healthy baby. In case if you're going for an ICSI, in that case you have the blastocyst. So they take the blastomeres, do a PGD, pre-genetic diagnosis, to see if this baby, if this embryo has any problem. They'll rectify it and then you can have a transfer. This we don't do routinely for all the patients. Only if they're having recurrent implantation failure or recurrent miscarriage, then they do a PGD. All these tests are a little expensive, but take it from me, it will really help you having a healthy baby and a happy life. Thank you.